Hey there, everyone. Welcome back to another episode of the Growth Room podcast, where we dive into all the facets of healthcare with experts who are leading the industry. Please join me in welcoming Kyle Kopek, the Chief Medical Compliance Officer at Braden Health. Thank you so much, and we appreciate you for joining us, Kyle. Can you please tell us about yourself and what you do at Braden Health?
Absolutely. Thank you so much for having me, Sal. So I'm one of the co-founders and, like you said, the Chief Medical Compliance Officer at Braden Health. Braden Health was started several years ago by two friends and myself down in Ave Maria, Florida. The nearest hospital to us was about 49 miles away, and there were only one or two ambulances in the community. As you can imagine, the access to healthcare was essentially non-existent, which led to quite a bit of unfortunate events in our community. While many of those events were quite tragic and very personal to myself and the others I work with, we use that as motivation to start the organization and turn it into what it is today, which purchases failing rural hospitals and rebuilds failed rural hospitals and reopens them. Today, we are one of 28 organizations in the United States authorized by the U.S. Department of Health and Human Services, the Agency for Healthcare Research and Quality, to conduct patient safety, advocacy, and quality improvement activities in all clinical specialties and disciplines. Prior to joining Braden Health, I spent some time in the United States Coast Guard Auxiliary, starting off as a flotilla staff officer, eventually joining Legal Services Command, becoming the staff member for 4 flag officers. And I was responsible for redesigning the way U.S. Coast Guard attorneys deploy to natural disasters nationwide. After leaving Legal Services Command, I was assigned to an internship within the Executive Office of the President of the United States. And afterwards, I was appointed to the National Staff of the United States Coast Guard Auxiliary, first as a branch assistant and then as a branch chief. I've attended the United States Coast Guard Auxiliary University program, graduating with honors and distinction, as well as Ave Maria University, and after that, Cornell University's Sloan program. Since graduating, I've lectured at both the University of North Carolina and returned to my alma mater, Cornell University, to lecture on healthcare, rural healthcare, technology, and innovation.
Wow, that sounds like definitely, you've definitely been really focused on this. So how long ago did you start Britain Health?
Yeah, so we started Braden Health. We had the idea, I'd say, about 10 years ago, but it really didn't start to get going until about 5 years ago. With any startup, there's a lot of research, and with rural healthcare, there's even more research because rural healthcare has found itself in this interesting problem where out of the 500 or so rural hospitals that exist, 180 of them have closed over the past 10 years. So while we were figuring out how to run the organization, we also had to figure out what others were doing wrong in order for us to be successful at it. So the first 5 years or so were not really revenue generating, and we didn't really own any facilities, but we were just very carefully researching and accessing facilities wherever we could. In fact, between Dr. Braden, Joseph, and myself, we've been to about 180 or so rural hospitals. I've personally been to about 70 of them on 4 different continents. And then on April 1st, 2020, we purchased our first failing rural hospital in Tennessee, the Henderson County Community Hospital.
How do you define rural hospital?
So rural hospital is, the definition is pretty straightforward. The Health Resource Services Administration, or HRSA, has a designation for them. Typically, they're about 50 beds or less, some a little larger, some a little smaller. And there are 2 types of rural hospitals. There's your standard fee-for-service or PPS hospital, which is paid on the typical payment model. And for even smaller rural hospitals, there's a critical access hospital designation. And while this is definitely a bit of an oversimplification, they are essentially paid on their costs plus a little bit extra because of their low volumes.
Got it. I see. So do you primarily focus on revitalizing the failed ones, or do you focus on creating new ones, or do you know what the new what the model looks like for creating a successful hospital in the rural area? Like where's your focus? Or are you doing all of that?
Yeah, so I would say we are doing all of it. Initially, we started with a hospital that was in the process of failing. We actually purchased it on its last day of operation. Since then, and since we've experienced a pretty healthy amount of growth, we've done both models, from starting with an abandoned, war-torn looking facility that was full of asbestos and mold and had a roof collapse, and torn it down and rebuilt it and reopened it. And we've also gone to other hospitals that are like that first hospital that have failed. So we have both models running, and they both work really well. What's been very fun has been the opportunities we've had to fine tune that model and make it work even better. And I think with anything, it's a very good learning experience for us. And what I think our peers have noticed is, as we continue to grow, we continue to learn, and we continue to use those lessons to fine tune our model to make sure we're more efficient, which means, it's a bit of a technical term, but to break it down in simple terms, the more efficient we are at deploying our model, the more lives we can save, because it allows us to reach more people in a much faster way.
Yeah, that's pretty much it, right? So how critical is technology in your day-to-day processes? Like what processes, tools, or tech do you rely on to perform optimal?
Yeah, so I'd say technology in rural hospitals is really the make it or break it for a rural hospital. We've been to many of them which are running on 1980s technology, which doesn't work. In medicine, things that are older than 10 years are essentially obsolete, right? Just like many of the science textbooks, you go out and there's a reason why there's a fourth edition, fifth, sixth, seventh, and eighth. Same for rural hospitals or any hospitals, right? So I'll give you some examples to sort of really draw that point home, or make it more clear, I suppose, which is, your CT machine or your CAT scan machine. A lot of these rural hospitals we've gone to have had 4-slice machines or 8-slice machines. Those are incredibly, incredibly old. The standards that we look at are anywhere between 64 and 128 slices. And for those of you that are not in healthcare, and I'm going to give you a bit of a simpler explanation. For those of you who are in healthcare, I realize this is a bit of an oversimplification, but the point is to make it a little easier to understand. A 4 to 8 slice CT scan machine, it's essentially like looking at a black and white television, versus the 64 or 128 slices that would be your 4K or 8K models, and are 3D and that sort of thing. So it's a very stark contrast. Pivoting to different parts of the hospital, everything from the way we chart, some hospitals are still charting on paper. Some use technology for charting that's written on 1960s code. And that's actually considered the national standard today, which is sort of insane to think about. Most hospitals still communicate via fax machine, which is also ridiculous, but leads us into sort of the way regulatory, or I would say overly harsh regulatory environment, has shaped healthcare. But also just in the phone system. We've been to rural hospitals that were still using that original switchboard style phones where you had to pull the 3.8 or 5 millimeter jacks to actually transfer the lines. And when you think about where you want your parents to be taken care of, or your kids, or your sister, or loved one, it's not a rural hospital, or any hospital for that matter, that uses that old technology. So for us, it's really critical to go in and update the technology. So, one, the diagnostic capability meets or exceeds the standard of care, but two, so our patients are comfortable being treated in that environment. If the technology is too old for one of my loved ones to be treated in, then it's too old to be used at our hospitals today.
Yeah, I mean, it sounds like technology is definitely the focus here with some of this stuff. I mean, if you're telling me some of these, hospitals are running systems from the 1960s and the 80s and pretty old systems, I mean, how you see the challenges of getting AI implemented into some of these, is this something that's just way too far ahead? Before we, I mean, even jump into the AI stuff, I mean, just are they even ready for automation, right? Like, are their systems configurable enough to automate some of these processes or workflows and whatnot? But before we jump into the automation and AI piece, uh, what about the team you lead? What kind of challenges are you seeing that they're facing, and what type of technical solutions do you think would improve their performance?
Yeah, so as far as challenges today, I think when it comes to AI, or when it comes to sort of boots on the ground, as far as what the day-to-day challenges are, I could definitely see a lot of benefit to that. But I think before we get there, before any healthcare system gets there, there's sort of two challenges, which is one, they have to come to a consensus on what their 5 top needs are. And hospitals don't operate like most businesses, where the executive can walk in and say, what are my 5 top goals? Um, the medical staff, which makes up the doctors and the administration, are in many cases at odds as far as what the goals are, or by design, there's some structural flaws there, which make it hard for physicians that have gone to medical school for 4 years and then residency for 3 to 5 years, and another year or two of fellowship on top of that, who are trying to deal with these highly technical issues that could be fixed with AI or any other technology, that are then running up against hospital administration, who have to figure out a way to pay for everything, but don't have that technical expertise to necessarily, in some cases, even comprehend the issues that the physician is trying to fix. And that creates sort of this gap that can be very difficult. Now, the way we've dealt with that is, our physicians, we have administrators that are physicians that practice for many years and can actually have that conversation with the physician, so we can figure out, what needs to be fixed. But on top of all of that, there's a very large underbelly of the healthcare system that a lot of folks don't talk about. I mean, we could spend hours talking about the benefits of clinical uses of AI. I think there's been some great experimentation with that. But on the back end, the actual billing the insurance companies, or getting someone's care approved by said insurance companies, what we're actually seeing that's sort of problematic is insurance companies are already deploying AI, or a lot of them more frequently use algorithms as they develop AI to deny patients care. And the problem is it's not using a technical argument or even a diagnostic argument. It's essentially just looking at flaws in the existing technology of a lot of hospitals' documentation systems and saying, oh, this required element of documentation is missing, or this note has a misspelling in it. So we're going to program our AI in a way to where it will automatically deny that claim, even though the patient needs that care. And I think that's why you've seen Congress and also the White House sort of come down a little harsher on AI early on in healthcare, because we want to make sure it's used to help people and not hinder them. Lastly, I'd say a lot of rural hospitals need to actually get their IT systems under control, right? You go to any business or you go to, most organizations, even nonprofits, they have a very clear IT structure that's very well together. In healthcare systems, it's just not that way. I'd say your best healthcare system is 60 years behind when it comes to what technology companies like Twitter are using in their own offices. The whole idea that you can message another employee in a hospital is only something that came around in the past 3 years. And I'd say only about 20 to 30% of hospitals even have that capability where, that's sort of old news for business. And the reason for that is because of the regulatory requirements, which are absolutely needed, but definitely need to be updated now that we have things like encryption.
Yeah, I mean, it brings to my mind AI bias, right? Now, everybody wants to deploy AI into their organization, but they quite don't know how AI is creating this problem of biases. Well, once you deploy the AI, like for example, the insurer part, right? All those errors that it's picking up from the billing systems, the AI is building some sort of bias internally. It's no longer an algorithm that's handling the responses to that, but now it's some sort of AI bias, and that's just AI bias in billing. It's going to be pretty interesting to see how these, well, the regulations from the government are going to come in to kind of keep control of that. I mean, or else everybody's going to be held at the mercy of these robots here. So it's definitely an interesting piece. But before we, I would say, jump into the AI part, do you feel like there is more progress that needs to be made on the automation side first before jumping to the AI piece, or do you feel like it's better to start gunning ahead, getting the AI stuff out there first because it has such a meaningful impact to things?
Yeah, I think the best way to make sure AI is used most effectively in the hospital setting, it's a very exciting thing and we're excited for it. I'm excited for it. But I think the best way to properly deploy it is probably you'd have to solve some of the existing structural problems with healthcare. Otherwise, it'll be just like when they deployed electronic charting systems in hospitals, where it was supposed to fix everything, but it was built on a broken system, a broken healthcare system. And what that did is it added workload, it added paperwork, oddly enough, which is the whole point of an EHR is to get rid of paperwork. And it slowed down providers' ability to take care of patients and nursing's ability to take care of patients tremendously. For many years was looked at as a huge failure. There's a documentary called Code Black, and it's not to be confused by the TV show with the same name, but it talks about how part of it talks about how the EHRs were supposed to be this great saving grace for healthcare, and all it did was slow these doctors down and actually sort of grind to a halt America's busiest emergency department, LA County Trauma Center. It's really worth watching. And what I would say is before AI is deployed in all of these systems to quote unquote fix everything, the systems should really take a big look at fixing themselves first and then building AI on the fixed system. Because that, once we figure out the automation and we figure out how these processes need to be run, and then you have AI come in and help where it can and does a really good job, it's going to help the healthcare system immensely. But, to use an example on the billing side of healthcare for, just to use a non-clinical example, we go to a lot of hospitals that can't that are not configured properly to actually bill the payers and receive payment for services. It's called basically submitting a claim and getting paid. And I know some folks in healthcare revenue cycle are going, well, that's an oversimplification. And it is. I mean, we're talking at the highest possible level. But many of those healthcare systems we go to and we've worked with, consulted on, even overseas that I've worked with, they are not necessarily configured to get paid properly. So if you build an AI system, right, especially, some sort of like or something like that, that learns or learns bias, as we sort of talked about, and it's fed bad information, well, now you're going to magnify your bad information problem. So I think AI is great. I just think we have to make sure, or any healthcare system has to make sure, that those processes are built out perfectly before it's used. Otherwise, our best friend could essentially become not an enemy, but it could become a hindrance because we're giving it bad information and then it's spitting out bad results. And for a lot of doctors, that's going to be very frustrating because, oh, here's another tool that's going to help me and it's just making my life harder. When it's not the tool's fault, it was the information it was fed. So, there's a lot of folks trying to fix that. We've sort of built our model very carefully and slowly and intentionally over a decade. So that way, when it comes to implementing new tech systems that we want to become the national standard, or when it comes to even, answering the question, how do we build a good EHR or how do we implement AI? That healthcare system is already built out to where it makes sense and we can feed it good information.
Yeah, AI bias can be either a trap or a journey. But aside from AI bias, another thing that has to be looked out for is cybersecurity. I mean, as AI gets better and better, cybersecurity is going to be more and more important. What are your thoughts about that?
Yeah, so cybersecurity in hospitals is a huge issue, and really the healthcare space in general. That's for a few reasons. I know a lot of the major players will try and say, oh, well, we did such a good job. We did our best, and then we got hacked. And there's no one could have seen that coming. But the fact of the matter is, when the most popular charting system in the US is built on 1960s code, and most companies won't invest in any sort of cybersecurity, you're sort of a sitting duck. And we've seen that a lot, and this is not to place blame on anyone in the examples I'm going to use, but Ascension Healthcare, in fact, one of their hospitals is over my right shoulder in Nashville. They have 140 hospitals, and their IT system was hacked. United Healthcare, the second largest payer in the United States, commercial payer, they went offline completely. And a lot of people don't realize that because Change Healthcare operates their IT system and their clearinghouse, which is essentially the system that processes payments to and from doctors all across the world and hospitals and clinics, went offline. That means 1 in 3 Americans, or even more in some cases, depending on if their federal contracts were affected, had all of their data leaked, all of their healthcare data. And people don't understand the magnitude of what that means. That means your testing, your lab tests, the medications you're on, the psychiatric consultations you may or may not have had, that is now owned. Well, not owned. It is now in possession of whoever hacked them. And they can do whatever they want with that data. One of the hospitals we bought, right before we bought it, was also the victim of a cyber attack. They didn't even have a basic antivirus. Their administrator password for their entire network was like 1, 2, and 3. And it was sticky noted on the front of the unlocked server room. It had been the victim of a foreign nation state attack. And pretty much was entirely taken over. And that was a county-owned hospital, which made it a political subdivision of the state. That state was attacked by a foreign nation, and their healthcare data was stolen. So when that happened, while we were trying to purchase the hospital, we got Congressman Green, who happened to be over that hospital's congressional district, involved and said, look, what are our options? Because we don't own this hospital yet, and there's a lot going on. He connected us with some folks at CISA, which is the cybersecurity agency for the United States, and they came in and essentially took the servers and raided the facility and did a full investigation. And through a very long process, and I won't bore you with all the details on it, we were connected with Microsoft and the White House and started talking about a lot of these issues and saying, look, cybersecurity is a huge problem. United Healthcare just went offline. All these insurers are getting attacked. All these healthcare systems across the US that are supposed to be industry experts, and many of them have done such amazing medicine and pioneered just incredible things. They can't keep their networks secure. A lot of these rural hospitals don't even understand the concept of network security. So Microsoft and our team at Braden Health, Joseph Rivera, our Chief Technology Officer, Luis Ferrero, our Chief Information Officer, and myself worked very closely with our friends at Microsoft and the White House. And actually today, about 4 hours ago, the White House just announced that we're all forming a partnership to deploy a cybersecurity program that's going to be funded and sponsored by Microsoft to go to these rural hospitals that are in trouble. We're very excited that our 3 hospitals, Haywood, Henderson, and Houston, especially Houston County, which is just this small little critical access hospital in Congressman Green's district, are going to be the first to receive this new program. And what's super exciting about that is because we've built this sustainable model for rural hospitals, it goes back to our earlier discussion, right? We know the model is built correctly. So now we get to really see how well this cybersecurity program for Microsoft works, because they don't have to worry if the failures are associated with the actual hospital model. We know when we evaluate this program, it comes down to how Microsoft set it up. And Microsoft is the leader in tech. So we're all super excited to see how this goes. And the White House and Congressman Green have both been a huge champion. And we'll be able to deploy this program nationally. And that sort of starts us on the right path to be able to bring the healthcare systems in the US up to, what for the rest of America is just every day. And then when we're able to do that, we can add things like AI and algorithms to the way hospitals take care of people. So that way we can take care of people even better, and more people get better, more lives are saved.
Wow, what an adventure it will be. My concluding thoughts are that AI has a big role to play in healthcare this year. Implementing AI really well will provide the most impact out of anything. It was such a pleasure having you on the show, Kyle. I'm looking forward to having you on for future episodes to infinity and beyond.
Absolutely. Thank you.